to spend a few minutes talking about breathing and how to properly breathe through lifting weights or various activities that you need to do throughout the house, and how that connects to your core strengthening, core engagement as well. So there's this concept called connection breathing. It's used a lot in different ways. Just a background on anatomy real quick. I'm trying to get the boring stuff out of the way. I'm going to scoot back so you can see my stomach. Your diaphragm sits under your rib cage, and your pelvic floor sits down at the bottom of your hip bones. And then you have your top muscles called your transverse abdominis, or your TA muscles. You also have your multifidi, which are in the back. They make the back side of your core, but for simplicity's sake today, I want us to think about how our diaphragm, our transverse abdominis, and our pelvic floor work together to help you manage pressure well in this core region. Now, this is a pretty hot topic right now for postpartum and pregnancy. And while that's near and dear to me because I'm going through pregnancy myself right now and I utilize it a lot in my strength training, it also can affect your hip and back pain. And so that's kind of the main focus of today. But like I said, it is a really good strategy to have and to be aware of if you are pregnant or you're dealing with postpartum, as well as far as pressure management, dealing with diastasis recti or pelvic pressure or incontinence, or even hip and back pain as well. So diaphragm, pelvic floor, transverse abdominis. Your diaphragm, when you inhale, it contracts and moves down, okay? Your transverse abdominis, your core muscles, are a deep layer of your core muscles that their fibers run this way. So think of them as a corset. When they contract, they are going to pull everything in nice and tight. And then your pelvic floor is what supports your organs, your bladder, your rectum, and if you're a female, uterus. And they more or less are like the most bottom layer of what's left of you. If you didn't have your pelvic floor, everything would fall out on the bottom, essentially. So a lot of people think of Kegels when they think of pelvic floor, which is where they're contracting their pelvic floor. And while that is a piece of this, it's not the only piece. But mainly today, when I'm talking about this connection breathing and this piston breathing, the point of this is you want them to move well together. So for example, I need you to think of your core as a closed pressure system because that's what it is. So if you increase the pressure on one side, okay, it's going to have a domino effect and affect another part of your core. So for example, if you have a balloon and you squeeze the middle of it, the pressure that goes up or down, right? It has to go somewhere. It's going to be displaced somewhere. So it's the same with your core. So for example, when you inhale, okay, your diaphragm comes down. You also want your pelvic floor down here to go down together to maintain that equal pressure. So it's a piston effect where you're moving up and down. So the same thing when you exhale and your diaphragm moves back to its starting position, you also want that pelvic floor to come up, okay? So you can see how being able to manage your pressure well in this area is going to help you. More or less, it's gonna prevent you from maybe sending pressure backwards towards your hip or back as far as leading to hip or back pain. But it's also gonna help you have that stability in your big lifts and your strength training that allow you to be a little bit stronger, less pain, more efficient with your moves. Because you don't want to lose laxity here, right? When your diaphragm comes back up and your pelvic floor stays down, or your transverse abdominis doesn't kick in to help. You don't want to lose that pressure either, because then you can also have risk for injury, or again, you're just a little bit weaker in that area when you don't manage your pressure well. So the best way I start my patients with this, and I think this is an exercise that's applicable to every single person on this earth. Now, do I think it's the only strategy and the only way to breathe? Absolutely not. And every single every single person's goals with this breathing is going to be different. So in strength training, it's a big hot topic, the Valsalva maneuver. So that's how you brace. You take a big breath and then you hold your breath throughout the entire brace. While I think that has its place, if you are dealing with hip pain, or again, those diagnoses I kind of brought up a minute ago with postpartum, your diastasis recti, incontinence, or pressure, it's probably not your best strategy at this point. I usually, with my athletes, will encourage them to try to maintain some sort of breathing strategy throughout their lifts, until they get heavy enough that they are close to their 80-85% 1 rep max. To me, it just allows you to really work this system well and be proficient at it, so that when you do tap into needing more strength or more core stability with the Valsalva maneuver and those heavier lifts, it's just not your structures haven't just been subjected to that every single time you lift. It's more of you tap into it when you really need it versus it being your default. So how I practice this with patients and how I try to coach them through this. We'll see if my camera lasts. Okay, I'll scoot back just a little bit. Actually, I'm gonna move this down just so I can make sure y'all still can hear me. Okay. So when you take an inhale, so you're gonna start trying to do this connection breathing with your inhale and exhale. When you do an inhale, I want you to think about filling your stomach. So many people fill their chest. Okay, I don't want to see a bunch of chest movement. Ideally, your stomach is rising, so you're going. Okay, so that's using your diaphragm. So every time I inhale and I take a breath in, my diaphragm travels down. Okay, at the same time, my pelvic floor should be traveling down. Now, a lot of women who struggle with some of those issues we talked about, they think, oh, my pelvic floor is not strong enough. I just need to be able to do some Kegels and tighten it, when it could be the opposite, that you potentially may have too much tightness and tone going on there, and you can never get it to relax. So you want to think about your diaphragm coming down as you inhale, okay, your pelvic floor coming down, which really just means I need you to try to relax everything down here. Okay, it feels weird at first, I promise. You will appreciate things being relaxed once you do that contraction in a minute of your pelvic floor. So just start by being able to fill your diaphragm and think about letting everything go down here. Okay, now on the opposite, what I want you to do as you exhale, I want you to think about now your diaphragm is returning. Okay, you want to think about pulling your pelvic floor up. And as your pelvic floor starts to turn on, your transverse abdominis, those tight core, the front corset core muscles will turn on as well. Okay. Some women like the term, they think about pulling a marble in. Okay, that's fine if that helps you. If you're a man, I know that sounds weird, but still worth, think about squeezing your rectum. That's fine too. Your pelvic floor is still turning on. As you turn on that pelvic floor, I want you to think about riding an elevator and continuing to zipper all the way up to your ribs, where you even contract those muscles right there as well. So altogether, what that looks like is you've got an inhale, diaphragm down, pelvic floor is relaxed. As you exhale, I'm contracting my pelvic floor, turning on my TA, all the way up to my ribs turning on. You do not want a bunch of extra stomach movement. So relatively, this is a small move. You are feeling the pelvic floor, you're feeling that rectum or that squeeze at the bottom, okay? Then you'll feel the tightening under your hands if they're close to your hip bone, okay? And then you're thinking about continuing that contraction all the way up to your ribs approximating. So not a lot of stomach movement, okay? More or less just zippering up, getting everything nice and tight as you exhale. So inhale, loosen, exhale, tighten. Okay, so I'll show you. Inhale, and then exhale. Zipper all the way up, nice and tight. I also am 20 weeks pregnant, so my belly does not go as flat as y'all should. And that's fine, but I want you to visually think about your stomach should be flattening. It should not be popping up. You should not see a lot of movement. Again, you are thinking about flattening. Those corset muscles are going to pull everything this way in tight. So if you're tapping into the correct muscles, you should not see any stomach coming up or a lot of extra movement. Once you feel like you conquered this breathing, I start to encourage my patients. This is where it comes in with lifting. I need you to start pairing your breathing with your lifts, as far as I want you to, there's two options, but I'll just share one today. I want you to focus on inhaling on, exhaling on the work. So for instance, a squat, it'll be an inhale on the way down, exhale as you stand. A lot of my athletes, they either hold their breath throughout the whole movement, or they have a split second where they bear down and hold their breath at the bottom of a movement. So like for a squat, they inhale on the way down, they hold their breath, and then as soon as they get past that hard sticking point in the squat, that's when they start to exhale. If you are dealing with back pain, that is not necessarily ideal while you're having back pain lifting. So if we can inhale on the way down, exhale as we stand, okay, that's more where I'm gonna start coaching you. Same thing for deadlift. Inhale on the way down, exhale as you stand. The goal of this is that you begin to retrain your nervous system. How to, if you start pairing your inhale with loosening and exhale with tightening, and that's like your default, your foundation of how you breathe, then when I say, okay, exhale on a lift, your nervous system kicks in those muscles that you've spent a lot of time in repetitions learning how to contract your core and pelvic floor muscles. So they by default kick on versus you having to consciously think about all these different things when you're lifting. So to start, if this is your first time ever hearing any of this, or you want to get better at it but you don't know how to start, lay on your back for 2 minutes a day and focus on inhale, loosen, exhale, tighten. Okay? Then I want you to start throughout your day thinking about inhaling on the exhaling on the work part of a movement. So the exhale on the hard part. So right before you stand up from a chair, if you're having back pain, or maybe it's when you're having a little bit of leaking, try to inhale before you stand, and as you stand, exhale and breathe through the movement as you do it. If you're going to sit down on the toilet, inhale, exhale as you sit. If you're going down to pick up a case of water bottles, inhale on the way down, exhale as you stand. So those two things, lay on your back, practice the breathing in the first place, really start to be aware of how to contract those muscles, to because you don't want to go 100% all the time with these muscles. So to what level, I guess, of contraction, so 20, 30, 50% turning on these muscles. So becoming super aware of how to do the movement, getting really skillful at it and being able to control it well, and then start incorporating it into your everyday activities where you exhale on the hard part of your movements. That should help you hopefully manage your pressure better to help with either hip or back pain, as well as, like I said, those potential diagnoses with, like I said, postpartum or whatever you may be dealing with as far as pelvic floor symptoms. I know that was a lot. If you have any questions, please reach out to me. Will to Perform Therapy is the name of my company. It's Dr. Sadie Hawk _ DPT on Instagram, and then Will to Perform Therapy on Facebook. So my contact information is on there. You can also text me. You'll find my phone number too. So yeah, thanks for tuning in, and hope you find this information useful.